Hi, I'm Terry Gilliam with the Leading California Groups. Today, I am proud to introduce my very good friend, Patrick Mazer. Patrick is an international businessman with business all over the world. And he approached me a couple of months ago with this concept of health sharing versus health insurance. And I know that there's a lot of people in our group who are either in California struggling to make their health care payments, and also those who are looking to move who are saying, I got to move. I've been with Kaiser for 20 years. What do I do? They don't have Kaiser in Florida. What do I do? So Patrick has an option here that I think will be very appealing. And so Patrick, why don't you say hi to our group?
Hey guys, great to be here today. Excited about talking a little bit about this very painful situation that we've all been in, which is paying for healthcare coverage for ourselves and our family. Something that I've struggled with for over 22 years as a self-employed person, having to navigate the waters of healthcare for my family.
Well, you came to me and you said, Terry, I've got a healthcare option that is less than half per month of what I've been paying, and I have better coverage. Now, Patrick, that just doesn't sound right. That sounds like smoke and mirrors. Can you explain what you're working with and who you're working with and how they're able to accomplish that?
As we all know, there's a very broken system in the healthcare industry, and networks and no networks, and you went to the wrong doctor, and all the things that I'm sure we've experienced in our dealing with the healthcare industry. So for about 40 years, in the Christian community, they did something called health share. You might be familiar with companies like MetaShare. If you listen to Dave Ramsey, he talks about it probably every show. But the challenge with that is you had to be a Christian. You had to get an affidavit from your church saying you were in good standing. And I always thought that was the gotcha. Terry, like, yeah, I'm in good standing, and hey, denied my claim because I didn't go to church, 82% of the time. So I've never dug into that, only because it sort of stopped me, at that particular junction. Because of the Obamacare law, they said no longer could health share just be in the Christian community, and companies now have started who no longer ask the religious question. If you're agnostic, if you are a Muslim or Jewish or don't go to church at all, no longer is that question going to be asked. So there's a company that I found called Impact Health, and what Impact Health does is health sharing, but they do it for people that don't want to have the question asked about religion.
Hmm. And impact. So can you explain the difference between health insurance and health sharing?
So health sharing is the exact same concept. If you think about what does, a health insurer do? They get a bunch of people like us to all put our money in a pod. And as people need coverage, they dole out the money according to the needs of the client, and hopefully make enough money that they can pay their CEOs and everybody all the big salaries. When you look at Impact Health Share, they're doing the exact same thing, but they're doing under the non-profit entity. So they're no longer trying to create revenue for profits. They're actually in a 501c or nonprofit entity, which means they're here to serve the members. Matter of fact, the company that I'm talking about last year gave back over $600,000 to the members, because under the nonprofit guidelines, if you don't use the money, you got to give it back. So exact same concept. If you're familiar with companies, like Blue Cross, where, hey, if I walk into the emergency room, you probably could see that $600 emergency room payment. This was a $3,000 health care for my family. $3,000. I had a $6,000 deductible, right? I go to this company called Impact Health, and you could see right at the bottom, walk into a doctor, right? ER, $150, Terry.
Wow.
And so I went from a $3,000 to a $900, from a $6,000 deductible to a $2,500 with Impact Health. Now, here's my welcoming letter from Impact Health. It says, number one, no network limitations. How many of us like that? Go to any doctor. You want to go to Harvard Medical. You want to go to Johns Hopkins. Look, I don't want to go to the McDonald's doctor that my previous healthcare company said, these are the doctors you're only allowed to see. it's called a network, right? So if you go outside of the network, they will not pay any claims. Here is no network limitations. Number two, it says, present your Impact member card and ask the provider to bill Impact using the information on the back of the card. Step three, for non-emergency care, consider using telehealth because it's free.
Hmm.
So imagine if our healthcare company said, look, before you get in the car and go to the ER or go to the urgent care or go see the pediatrician, why don't you talk to a doctor on the phone, establish whether you even need to go, maybe a Z pack or some of the things we all had to do. Hey, you got a cold, don't come into a clinic full of other sick people. Why don't you just go to the pharmacy? I'll get you the script and call me in 3 days. So it's just a really exciting time because of the fact that this didn't exist a handful of years ago outside of the Christian community.
So just to recap, you were paying $3,000 a month for medical insurance, and now you pay $900 a month for health sharing,
Saving over $24,000 a year. Now, look, Terry, whether you called me, a stranger on the street, or somebody knocked at my door and said, I found a way to save you $24,000 a year on your health care, I would have entertained the conversation. Now, in the back of my head, I'd have probably said, there's no way you can do it. But even if you saved me 10 grand, that would have still been a big number. So that was my initial, if you will, introduction to this, and like anything, what do? We investigate. Come to find out, been around 40 years. Come to find out, people are using it all over the United States. That this is not a new concept, it's new to the non-Christian community.
I see. And then you told me something recently that really struck me, because it's great that they're a nonprofit, because I know that health insurance companies make billions of dollars a year in profit, which of course comes from the premiums that they collect. But you told me that 5% of healthcare costs, 5% of the population accounts for almost 50% of all the healthcare costs in this country. And those people are excluded from health sharing. Is that right? Do I have that right? And that's why they're able to not charge as much per month?
Yeah, so couple things they do. Number one is we start with a healthy customer. Let's start there. You know what I mean? So 55% of us pay for 5%. 55% of the healthy community pay for 5% of the unhealthy community. So they start out with, a very, very simple, hey, if you're in relatively good health, which a lot of people that, take care of themselves, like yourself, myself, we walk, we do things, we try to eat right. I'm a self-employed person. No one's going to come to my rescue. So I have a tendency to want to stay healthy only because of the fact that I don't have any alternative if I get sick. So they start with a healthy customer. Once you're in, you're in. So they do not throw you out for whatever reason. Once you're in, you're in. So they let you in. Now, high blood pressure, cholesterol, things like that, that's not, something that they're going to stop you from getting in. But the nice thing is they start with a healthy group of people. They never raise the rates according to claims, meaning, hey, you got sick, so next year we're going to charge you more. It only goes by age, so your age determines what you pay. And on top of that, you can see what your deductible is. They call it primary responsibility. So they have everything from a 2,500 to a 5,000 to a 7,000 to a 10,000. As far as what your responsibility would be, and then your rate is accordingly. And we can quote people. You got a really cool website I know people can check out. You can put your age in. It works really cool. So just to give everybody sort of a visual, if I take them to my Impact Health, this is all I would do. I would come in, I would put in the, let's say the age of the person, in this case, let's say 1979, and let's say it's just one person. Now look what it says. Freedom to go to any provider you choose. I would pay more money for that, Terry, not less, right? Meaning, if I want to go to the best of the best of the best at something, I don't want to be restricted, right? Free telemedicine. The pricing for pharmaceuticals are amazing. But let's say one person on the claim or one person on the policy, and they can get an idea, born 1979, let's say it's a husband and wife, just to keep it simple. I know there's a lot of couples on here. Two people, right? $268 a month, Terry. $2,500 primary responsibility, down to a $10,000 at $300. And again, that's two people on the policy, right? That's a husband and wife or whatever that may look like, a mom and a son or dad and a son or daughter. And let's say they like that idea. We just put their information in, submit, and then somebody from Impact will call them the nonprofit organization, which means lower cost to you.
Mm.
And so they're a great bunch. I was really impressed. I mean, look, if you work in nonprofit, I think you have a different mindset. You're here to serve. You're here to help. Just by nature of nonprofit, you're really dealing with somebody that wants to make a difference. That's not driven on profiteering and other things, as we all know in business. So it's just a really, really great organization.
Well, that's all great. That's great information. Can you also, for those who may have a pre-existing condition, can you address how Impact handles that?
So the definition of a pre-existing means in the last 36 months you've been treated, you take medication for, or you're having the symptoms of that problem. Let's say, for instance, you had an issue in the past, 5 years ago, and you haven't taken medication or had any flare up in the last 2 years. As long as for 3 years you had no flare up or no problem, you don't take any medication for it, that is not a precondition. If you are currently under care for that problem, that is a precondition, which means they will not pay for anything specific to that problem. They can take care of any other problem you might have, but specifically to that problem. So there obviously is going to be a section of society that might not be the right fit today, but maybe the right fit in 3 years because that problem is no longer a problem.
Well, and that's how they're able to keep the cost down, right? That's how they're able to keep these monthly premiums so low is, as you said, they're starting with primarily healthy people. And so I can understand, cancer treatment can be hundreds of thousands, if not $1 million. So I can certainly understand. Now, if you, as you said, though, if you get into it as a healthy person and you develop cancer, it's all covered, right? As far as the way the program works.
Walk in, you give them your Impact Health card, they bill Impact Health, and they take the bill and they pay the bill. So it works like what we're comfortable using all of our life, or at least me for 22 years. It works the exact same way. The benefit to this is no network, which I'm sure everybody has a story, right? I mean, who doesn't have a story of somebody that wrong doctor, wrong time? In my family, my wife had had a situation where her appendix were rupturing. So emergency room, she's looking at her policy to make sure she goes to the right hospital. Can you imagine in a time of need, you're worried about where the ambulance takes you? But fortunate enough, it was in network. She goes in, gets the procedure. God, she was in good shape. And remember, I'm a platinum member for Blue Cross Blue Shield, so I'm paying $3,000 a month for this policy. Get a bill in the mail for thousands of dollars, Terry. The anesthesiologist was out of network.
Oh my gosh.
So here we are paying $3,000 a month. I get a bill for thousands and thousands of dollars. The doctor's out of network. They denied the claim, meaning we will not pay this claim. So again, as a customer, you can only imagine how upset I was. Hey, it was baked into the rules. Hey, they're not going to pay every claim. It's pretty black and white in the policy. Obviously, they're not transparent about that. They don't say, hey, go to the wrong doctor, we're not going to pay. But I found out the hard way, as you can only imagine.
Wow, that's amazing. And then I know when I was employed, when living in California, I had an employer, and every year the employer switched to a different provider because Blue Cross this year was the lowest, and then next year it was United was the lowest. So we were always switching networks too, by the way, always switching who we could go to and everything else. Do people get into health sharing and then say, you know what, this was a big mistake? Do you know the kind of the turnover they have?
So great question, Terry. And look, I did a lot of due diligence. I'm a little analytical. You know what I'm saying? Especially when you're dealing with something like, look, I got kids. You know what I mean? I don't want to be in a situation where you work all your life to get into a financially good position, and then you have to give it all away to the medical community because of a bad situation that came up. So look, these guys have been in business for multiple years. They paid 20,000 claims last year alone. And as I met with the executive team, they have less than 2% turnover.
Wow.
So what does that mean? That means that nobody's going to get me today to leave Impact Health to go back to paying $24,000 more for health coverage. Right. Like, and I know there's some probably pretty good sales guys in the country and saleswomen in the country, but there's nothing that they could tell me that would make me want to go back to paying $24,000 more than what I'm paying right now with Impact. So I think what happens is people like myself and others, once they do their due diligence, once they really understand that, look, it's for a certain group of people. I'm not going to paint everybody with the same brush here today, but for those people that this is a fit for, they're not going to leave. And the reason they're not going to leave because a nonprofit healthcare company by nature is always going to charge less than a for-profit company. I
Yeah.
mean, if you just think about the fact that a nonprofit by its nature doesn't go out of business. I don't see too many churches going out of business these days, right? And even in a pandemic, I still didn't see any churches go out of business.
Yeah. And just can you repeat that again? They're so solvent that they gave money back to their members last year?
So under the nonprofit rules, if you don't use the money for what it was deemed to be used for, by nature they have to give it back. So last year they gave over almost $700,000 back to members. Now remember, that's because they didn't use it. Now that number's growing this year because of the thousands and thousands of customers we've put on in just the last 60 days from people like us that said, heck, I want to opt into this. So again, that pool's going to continue to grow as more members come on and more members are benefiting from the program. I'll give you an example. They every year they give you money, right, free of charge for a free physical, all the blood work, everything for every member for free. So they literally encourage you every year, go get your annual physical, go get all the blood work done. It's completely free, meaning you don't pay a dollar out of pocket. It's not like the office visits that we all have to pay something, if you will, completely free. And just think of the mindset there. Like, we want to make sure that people are healthy, because if everybody's healthy, we're going to keep the cost down. So the early finding something early is a lot less expensive. What do they say? An ounce of prevention is better than a pound of cure, I think, is what
That's
we've
right.
all heard growing up.
That's
So
right.
it's just I think its time has come. You know what I mean? It's one of those industries that, look, if you're a broken industry, eventually someone's going to come in and build a better opportunity around it. I see it with Airbnb. I've seen it with Uber, with rideshare. I mean, look at all the disruptors that have come into industries that, look, I mean, do we pay too much at a hotel? Some would say yes. And if you've ever compared it to an Airbnb cost, dramatically less expensive.
Yeah, that's great. Well, that's very helpful. Well, we'll put a link to that page where people can go and get a free quote. And then if they're interested in it, go ahead and pursue getting more information. And that's kind of how it works, right? They click the link, they put in that basic information, and someone reaches out to them. Is that how it works?
So once you go through the link below, and again, you're going to see, looking to save on health coverage, great, 50% or more. I mean, imagine if that was your mortgage company, save 50% of your mortgage. Or imagine if you were, going to buy a car and it says save 50% on BMWs, right? We all of us would want to know more on how that was possible. So they go through, they even have, at the website, basic, you can quote yourself. So I
Mm,
did one for a family of two. Let's say you have 5 kids, right?
mm,
And let's say you get in a quote, there's 3 plus. So let's say there's 5 kids in the family. It's 605.
good gosh.
Now, again, what's nice about this is you're now going to talk to a professional by putting your information in, and the professional is going to give you a call and they're going to go through everything with you. So they're going to talk about all the benefits. Look, they're so transparent as a company, you're going to love, because they're going to say things like, look, we're not an insurance company, which I love. Great. You know what I mean? You actually get a check in my book that you're not. You know what I mean? I
Mhm.
like that. Well, number two, they're going to tell you things like, we're not going to pay every claim. What does that mean? Meaning, look, like any healthcare company, there's always going to be that maybe we won't be here in 20 years type situation.
Hmm.
But they're so transparent, they say it. What I didn't get from the company that I was dealing with is, if you're out of network, you have to pay. Meaning, we're not going to pay every claim. They never said that when I signed up. I'm sure it's baked into the contract somewhere, as you can only imagine. They highlight that when they told me they weren't going to pay my claim, as I'm sure everybody's has a story of a friend or a family member or a neighbor that, has a healthcare horror story of, we had to pay a bunch of money that we didn't know that we were going to pay because it didn't cover whatever that was. So these guys are great. I wouldn't be advocating them to the level that I am if I am not a card carrying member. You know what I'm saying? Like, look, I'm promoting them because there's an opportunity for people like us who are maybe looking to make additional income. This is a revenue stream for me as a business. But I wouldn't promote something that I do not personally use. I mean, I don't think you can ethically or morally sell something that you aren't completely convinced works. They call it a transfer of belief, I think, is what I learned early on when it came to talking to people about things that you agree with.
Sure. And then let's just talk briefly about prescriptions. So you said that they've got a great prescription plan. I know I pay about $40 a month for my pills. Maybe we can.
So what's great about this is my back office. So this, literally I can look at anything that I have, my medical bills, but here's the pharmacy, right? And I was quoting somebody a little earlier just to give us an idea, like, hey, what would you pay for this particular drug? But somebody could come and they could check, okay, what's drug cost? So give me a drug that you take and then we can quote it.
Losartan.
LOS.
LOSAR. There you go. The bottom one with the hydrochlorothiazide.
All right. Why do they make these names so big? So,
because they've got a million different pills and they got to name every one of them.
So what did you pay for that? So if you look, did you have 100?
The bottom one there. Yeah. The 25 milligram. Yeah. 125.
Okay.
And then I do 30
Okay,
because I take one every day. And it's, and a month I pay about $40 for that.
So you pay about $40. You can see here a couple things. One, obviously $7 is a lot less expensive than 40. You're doing it with healthcare, so that would be your copay would be $40, correct?
That's right. That's right. Yeah.
This is the cost of the drug. So
Wow.
Terry, look, I mean, we've seen enough in the news. We've heard enough of people complaining about drug pricing in America. That's the true cost of that drug.
Wow.
So the $40 that you're paying is a profit center for the insurance company, even though they say it's your copay on a $300 drug. So when you go and hey, the drug's $300, you think, wow, glad I didn't have to pay $300. I only had to pay $40. When reality, it's a $7.50 drug. So look, this is really exciting because in an economic downturn, or when people lose their job, or when price matters, this is going to be really an exciting opportunity for people to protect their family, still have the coverage that we all want to have, put money in our pocket. And look, once you're in, you're in. Again, you're not going to convince me that I need to leave and pay $40 for a drug and a copay and $24,000 too much than what I'm paying now for the same coverage that was limited because of network limitations.
Yeah. Well, this has been great, Patrick. Is there anything else you want to add before we go?
Look, a couple things. One, we all have family, we all have friends. We're going to probably see people over the course of time that are dealing with the challenge of the healthcare industry. The number one reason people went bankrupt in 2021, the number one reason was healthcare bills. How many of us have people that are 26 years old, right? Just coming off their dad or mom's policy, and now they're out on their own. And, Terry, when you and I were 28 and 29, we were invincible, untouchable. Nothing was ever going to happen to us. And we all hear the stories, allergic reaction, had to go to the emergency room, had to stay in the hospital for 2 or 3 days. And I got myself a $60,000 or $70,000 bill from the medical facility. We know that there's people out there that are underinsured. We know there's people that have no health coverage. We know people lost their job, or, to your point, leaving California, where they're relocating to a new part of the United States, maybe having to give up their employment to leave. And now they're running on COBRA, or they're running on, a very expensive health coverage for their family. we've got a solution. So that would be number one is, awareness is really done through telling people and look, being a blessing to other people with, hey, this is something that might be an option for you. It's not an option for everyone, obviously, but for those people it is, check that box. But number two is I love the fact of sharing it with people, and I'm making money too. So there is an opportunity as well behind this. So look, if you're going to tell people about something and you can get remunerated or paid for promoting, if you will, great. Look, get the facts, get the details. If it's something you want to do, we'll pay you to promote it. And it's great. I mean, I've been promoting it here for the last couple of weeks. I brought hundreds and hundreds of customers to Impact. And I have yet to get one person, not one person that pays their own health care that did not go in for a quote. Not one person, Terry. And look, we've both been in business long enough to know you're not going to win them all. You're not going to have everybody that's going to agree to do whatever it is you're doing. But to know that I had 100% of people that at least went in for a quote, because people like us, that it is a big pain point. It is a big number that we pay every single month. And here's my experience in the healthcare world. The pricing isn't going down. Right. So if it wasn't painful enough this year, it might be enough painful next year to get you open-minded enough to go, there has to be a better way. There's got to be something else better out there than what I'm paying. And so I think as that naturally happens, more and more people are going to be looking for those alternatives. And that's what you have here.
That's great. All right. And so if people actually, you gave me the opportunity to look at this from a business perspective. So if people want to actually look at it also as a way to make additional residual income, they can actually message me through Facebook, and I can connect them with Patrick, and we can talk about that. Well, Patrick, this has been great. I really appreciate your help with this. I was stunned when you told me this. It was almost seemed too good to be true, but I've looked into it also, and I believe this will be the wave of the future for people being able to afford great health care instead of just saying, what the heck, we're throwing this massive amount of money into the garbage can. And, it's just, I just really think this is going to change people's lives financially. And I really appreciate you bringing it to me and to our Leaving California groups.
Hey, look, it's been my pleasure. I'm passionate about it. I'm a raging fan, as you can only imagine. And to your point, look, I mean, it's a broken system. So, excited about being an opportunity to help some people out there that fall into the category that we're in, which is paying way too much for something.
Yeah. All right. Well, I look forward to hearing about great success stories, and I'll share those with you. And again, thanks for your time today.